Welcome to the deep dive. Today we're diving into something pretty specific in the world of dogs, a heart condition that really messes with their internal rhythm.
That's right. We're looking at Sinus Syndrome, or SSS. And for this deep dive, we've pulled information from, standard veterinary guides and even some specialist study material.
Okay, so our goal here is to unpack SSS for you. We want to get into what it actually is, what it means for a dog if they have it, how vets figure it out.
And importantly, what the treatments look like. There are some surprising aspects and real challenges here.
Think of this as your way to get up to speed on a tricky bit of dog cardiology.
Exactly. Let's get started.
All right, so sick sinus syndrome. What are we actually talking about? You mentioned the heart's rhythm.
Yeah, at its absolute core, it's a problem with the heart's own pacemaker, the natural one, called the sinus node.
Okay, the sinus node.
Right, and it's not just like one single fault. It's more a collection of different electrical rhythm issues. Basically, the sinus node isn't making electrical signals properly, or maybe it's making them but not sending them out right.
Uh-huh.
And sometimes other bits of the heart's electrical wiring get involved too. It can be quite complex.
So if a vet hooks a dog up to an ECG, what would they see? Does it always look the same?
No, definitely not. You might see the heart rate is just, well, way too slow for this situation. That's called bradycardia.
Bradycardia, slow heart rate, got it.
Or you could see these really long pauses where there's just no heartbeat for a bit. Vets call that sinus arrest or SA exit block.
Wow, okay.
Sometimes you might even see a different, slower rhythm trying to sort of take over when the main one fails, an escape rhythm.
And you mentioned something particularly tricky, a specific variant.
Yes. This is where it gets really interesting and honestly quite dangerous for the dog. It's called bradycardia-tachycardia syndrome, or BTS for short.
Brady-tachy,
Yeah.
slow fast.
Exactly. You get these periods of really slow heart rate, or those long pauses we talked about,
Uh-huh.
alternating with sudden bursts of incredibly fast heart rhythms, specifically supraventricular tachycardias, SVT.
Mhm.
The heart rate just swings wildly.
Goodness, like flooring the accelerator and then
Yeah.
slamming on the brakes.
That's a great analogy. The source material actually gives a pretty dramatic example. An SVT hitting 250 beats per minute,
Wow.
immediately followed by a pause lasting over 6.5 seconds before just a weak little backup beat finally manages to fire.
That sounds incredibly unstable.
It really highlights the electrical chaos. So, okay, we understand the electrical side, this misfiring, but what does that do to the dog? Why do they get sick?
Right, what are the actual physical effects?
Well, interestingly, the ECG changes, the weird rhythms, might actually be there before you see any obvious signs in the dog.
Oh, okay.
The real trouble starts when those backup systems, the heart's escape pacemakers, fail to kick in properly or quickly enough when the main sinus node falters.
So it's like the main system is broken and the emergency generator is sputtering.
That's a really good way to put it, yeah. So the common signs you see, like weakness or fainting, happen because there's a temporary drop in blood flow getting out to the body.
Especially the brain.
Especially the brain, yeah, and the muscles, too. The heart just isn't pumping effectively during those slow periods or pauses. In rarer cases, it can even lead to congestive heart failure.
So even though it starts in the heart's electrical system, it ends up affecting the brain, muscles, maybe even kidneys, because they aren't getting enough blood consistently.
Precisely. They all depend on that steady, oxygenated blood supply.
So what actually causes this? Why does a dog's sinus nodes start failing?
That's the million-dollar question sometimes. In a lot of cases, maybe most, it's termed idiopathic.
Meaning we don't really know.
Pretty much, but it's very strongly linked to aging. Think of it like wear and tear degeneration, maybe some scarring, fibrosis, happening in or around that sinus node tissue as the dog gets older.
But it's not just random aging, is it? I remember reading there are strong breed links.
Oh, absolutely. The breed predisposition is quite striking. For some breeds, they even suspect it might be hereditary, passed down in families.
Which breeds are we talking about primarily?
Miniature Schnauzers are the classic example, along with West Highland White Terriers. A genetic link is really suspected there.
Okay.
But you also see it frequently in Cocker Spaniels, Dachshunds, Pugs, German short-haired pointers. Boxers are often mentioned, specifically relating to fainting episodes with long pauses.
Right.
And Old English sheepdogs, too. Demographically, it tends to hit middle age to older dogs, mean age over 6 years. And interestingly, it seems to affect females more often than males.
So an older female miniature Schnauzer, for instance, would be a prime candidate.
Definitely a breed and demographic to be aware of for SSS.
Are there other things besides just age or genetics that can trigger SSS? Acquired causes?
Yes, there are. Sometimes other heart problems like inflammation, myocarditis, or certain types of heart muscle disease, cardiomyopathy, can damage the node. Even infiltrative diseases, like, say, a tumor growing near the sinus node, could disrupt it. And then there are drugs.
Ah, medications. Which ones?
Certain heart medications themselves can be culprits. Beta blockers, calcium channel blockers, digoxin. Even some other antiarrhythmics can slow the sinus node down too much.
Okay, important to know.
And systemic illnesses can play a role too. Things like severe hypothyroidism or really out-of-whack electrolytes, particularly high potassium, hyperkalemia, can affect heart rhythm. Even some neurological diseases that increase what's called vagal tone, the nerve input that naturally slows the heart, can contribute.
So a lot of potential factors beyond just the node itself wearing out.
Definitely. It requires careful investigation.
Okay, so we've got the what and the why. Let's talk about the what does it look like. For an owner living with a dog, what signs should they be watching for?
Right. The signs can be really variable. It depends heavily on how slow the heart actually gets, or how long those pauses are, and crucially, how often these episodes happen.
So it might not be obvious all the time.
Exactly. Owners might say their dog seems totally normal most of the time, for weeks or months even between episodes.
But then
But then when the signs do hit, they can range quite a bit. It could be subtle stuff like just seeming a bit weak or tired, maybe less willing to exercise.
Okay.
Or it can be much more dramatic, collapsing suddenly, actual fainting, which vets call syncope. Sometimes, though less commonly, it might even look like a seizure.
Fainting or seizures, that sounds scary.
It is scary for owners to witness. The key thing is these episodes are often quite brief, transient, and the dog usually recovers quickly on their own afterwards. And importantly, while it looks frightening, actual sudden death from SSS is considered infrequent.
That's somewhat reassuring. And what might a vet find during an examination?
Well, again, it depends if the dog is having an episode during the exam. The vet might listen with a stethoscope and hear that the heart rate is abnormally slow.
Or fast, if it's that BTS type.
Or fast, exactly, if they happen to catch it in a tachycardic phase. They might also detect pauses, skipped beats.
But what if the dog seems fine at the vet's office?
That's the challenge.
Don't
Just
I-
like the owner's experience, the physical exam can be completely normal between episodes. The dog might look perfectly healthy sitting there in the exam room.
Okay, so you have a dog, maybe one of those predisposed breeds, showing these worrying signs like fainting. But the exam might be normal. How does a vet actually pin down the diagnosis of SSS?
Yeah, diagnosis is definitely a process. It involves being systematic and, crucially, ruling out other things that could look like SSS.
What kinds of things are on that rule-out list?
It's pretty broad, actually. First, you need to differentiate it from things that are normal, like really athletic dogs or any dog when deeply asleep or relaxed can have quite slow heart rates, sometimes down to 30 beats per minute, and even pauses up to about 3.5 seconds. That's normal physiology.
Right, context matters.
Absolutely.
Yeah.
Then there's high vagal tone, that nerve input slowing the heart. Sometimes it's just a dog's normal state. Other times it can be increased by, say, respiratory issues or even stomach upset. We mentioned drugs already. You have to check if the dog is on any medication that could cause bradycardia. And critically, you have to consider non-cardiac reasons for collapse or weakness. Is it actually a seizure disorder? Is there some metabolic problem causing weakness?
So neurological or other systemic issues.
Exactly. And there's another heart condition called atrial standstill, often linked to that high potassium we mentioned, which can look electrically similar in some ways but needs different management.
So the first steps are often general health checks then, blood tests.
Yep. Standard baseline, blood work, CBC, chemistry panel, urinalysis is almost always done. Usually these results are normal if it's just primary SSS.
Right, but they're crucial to rule out those other things.
Exactly. You rule out kidney issues causing high potassium, check thyroid levels, look for other systemic clues.
What about imaging, like chest x-rays or heart ultrasound?
Good question. Thoracic radiographs, chest x-rays, are useful to assess the overall heart size and check the lungs, especially looking for signs of congestive heart failure if that's suspected.
And the echo, the ultrasound.
An echocardiogram is really important. It lets the vet look closely at the heart structure and function, the chambers, the valves, the muscle thickness. They're checking for any other heart disease that might be present, especially in breeds prone to multiple issues or if they heard a murmur.
But the echo doesn't diagnose the SSS itself.
Correct. It provides vital context about the heart's overall health, but SSS is an electrical problem, so you need electrical tests to diagnose it.
Right. So the ECG is key.
Absolutely. An in-clinic ECG is the starting point. If the dog is showing severe signs right then and there, you might catch the characteristic pattern.
What are you looking for specifically?
You're looking for that persistent, inappropriate slow heart rate, those significant pauses usually defined as longer than 4 to 6 seconds, or maybe more than twice the normal beat-to-beat interval, or evidence of SA exit block where the signal is made but doesn't get out, or seeing those backup escape beats trying to kick in.
And if it's the bradytachy kind?
Then you're looking for that distinctive pattern. Runs of fast SVT followed by those really noticeable, often prolonged pauses. Those post-tachycardia pauses are a big red flag for BTS.
But you said the signs are often intermittent, and the in-clinic ECG might be normal. How do you solve that?
Ah, yes. This is where we get to the diagnostic gold standard for SS. It's the 24-hour ambulatory ECG. You probably know it as a Holter monitor.
Right, the dog wears it out.
Exactly. It's a small device, hooks up with electrodes, and the dog wears it in a little vest, usually for 24 hours, sometimes longer. It records every single heartbeat while the dog is going about its normal life, sleeping, eating, walking, getting excited.
That makes so much sense for catching something intermittent.
It's essential. It allows the cardiologist to quantify just how slow the rate gets, find those transient pauses that correlate with the owner's reports of collapse or weakness owners, often keep a diary, and definitively confirm bradycardia-tachycardia syndrome if it's present.
Are there specific criteria on the Holter, like how long a pause needs to be?
Generally, pauses over 6 seconds are considered highly significant, but even shorter pauses, say 4-6 seconds, if they clearly correlate with clinical signs noted in the diary, are very suggestive. And of course, seeing that clear BTS pattern seals the deal.
Okay, Holter is key. You also mentioned an atropine response test. What's that about?
Yes, the atropine test. It's used to help figure out why the heart rate is slow. Is it because the sinus node itself is sick? Intrinsic SSS, or is it just being suppressed by too much vagal nerve input?
How does it work?
Atropine is a drug that blocks that vagal input. So you measure the heart rate, give atropine, and measure again. In a normal dog, or one whose slowness is just due to high vagal tone, the heart rate should jump up significantly, maybe more than a 50% increase, or get above 140 beats per minute.
And in a dog with SSS?
If the sinus node itself is damaged, blocking the vagal input doesn't help much. So dogs with true SSS typically show very little or no increase in heart rate after atropine. It suggests the problem is inherent to the node.
But you mentioned it can be misleading sometimes.
Yeah, the sources caution it's not foolproof. Some SSS dogs might have a partial response. Some dogs with high vagal tone might not respond fully. It's a piece of the puzzle, but not the only piece.
And briefly, electrophysiologic testing. Is that common?
Much less common. That's usually reserved for specialized cardiology referral centers. It involves inserting catheters into the heart to directly measure electrical signals and pinpoint where the conduction problems are. More invasive, definitely not routine.
Okay, so let's say the diagnosis is confirmed, SSS, maybe with syncope.
Yeah.
What can actually be done? What are the treatment options?
Right, treatment. The main goal here is really clear. Stop the clinical signs, especially the fainting, and give the dog a good quality of life back.
What if the dog is diagnosed maybe from a Holter, done for other reasons, but isn't showing any signs?
Good point. For asymptomatic dogs, the general recommendation is often no treatment, just monitoring.
Okay, but for the ones collapsing?
For dogs having active signs like syncope, the immediate management of an episode is usually just letting it pass, as they're often self-limiting. The big decision is about long-term strategy.
And what's considered the best long-term solution for those symptomatic dogs?
The veterinary sources are unanimous on this. For dogs with recurrent syncope or severe lethargy due to SSS, the gold standard treatment is implanting a permanent artificial pacemaker.
Like the ones people get?
Very similar concept, yes. It's a surgical procedure where a small pulse generator, the battery pack, is placed under the skin, usually in the neck or shoulder area. A wire, called a lead, is then guided through a vein, typically down into the right ventricle of the heart.
And then takes over pacing?
Exactly. The pacemaker monitors the heart's natural rhythm. If the rate drops below a certain programmed level, the pacemaker kicks in and delivers a small electrical impulse to make the heart beat. It provides a reliable safety net. The most common type used in vets is called VVI, ventricular pacing.
Okay, pacemaker's the gold standard. What about medications? Can drugs manage SSS effectively?
This is a really important point in the sources. Medical management is discussed, but it's consistently described as, well, palliative at best, and often having pretty limited success, especially for severe SSS.
Palliative. So, just symptom relief, not a fix.
Pretty much. And often, any initial benefit the dog gets from medication doesn't last long term. The drugs might lose effectiveness over time.
So it might help a bit at first, but the underlying problem isn't solved.
That's the core issue. Drugs like propantholine, it's an anticholinergic, works a bit like atropine or terbutaline, or theophylline might be tried. Maybe particularly in dogs who only have the slow heart rate issue, not the fast component, and showed some response to that atropine test. Or, frankly, sometimes it's tried if the cost of a pacemaker is prohibitive for the owner.
But they have downsides.
They do. They don't fix the sick sinus node, and they can cause side effects. Dry mouth, tummy upset, maybe anxiety or restlessness. And crucially, they can sometimes make things worse, especially if there's that tachy component.
Right, that brings us back to the Brady-Tachy syndrome. How do you manage that medically?
The sources are very strong on this. Trying to manage BTS with drugs alone, without a pacemaker, is really risky.
Why is that?
Because the drugs you'd use to control the fast heart rates, like beta blockers or calcium channel blockers, can severely worsen the slow periods, potentially causing more collapses or even asystole where the heart stops.
And drugs to speed up the slow rate could make the fast rates worse.
Precisely. It's a catch-22. So, for BTS, pacemaker implantation is generally considered necessary first. Once the pacemaker is in and providing that reliable baseline rate, then you can cautiously consider adding medication to manage the fast episodes if they're still happening and causing problems.
The pacemaker acts as a safety net, allowing other treatment.
Exactly. It prevents the life-threateningly slow rates. And, of course, part of the overall plan is always managing any other concurrent issues, treating hypothyroidism if it's there, managing any structural heart disease, and definitely stopping any drugs that might have been contributing to the SSS in the first place.
Okay, so thinking long-term now. A dog gets diagnosed, maybe gets that pacemaker. What's the outlook? What's the prognosis like?
Yeah, putting it all together for the owner. What does the future hold? Well, for a symptomatic dog without treatment, the prognosis is generally considered poor.
Poor meaning.
Meaning their quality of life is significantly impacted by the weakness, the fainting episodes. And while sudden death isn't common, it remains a risk.
It sounds pretty bleak. How much does the pacemaker change that picture?
Dramatically. This is the really positive part. The prognosis with successful pacemaker implantation is typically described as excellent.
Excellent how?
Excellent for resolving the clinical signs. The fainting usually stops completely, the dogs regain their energy, their quality of life improves immensely, and they often live happily for several more years.
That's a huge difference.
Yeah.
What about just medical management then?
With medical management alone, the prognosis is much more guarded. Any relief is often only temporary or partial. The signs are likely to persist or come back. It just doesn't address the fundamental problem like a pacemaker does.
So communicating all this to the owner is absolutely critical.
Absolutely vital. Owners need to understand the nature of the disease, sometimes explaining it as the heart's natural pacemaker failing helps. They need to grasp the limitations of medications versus the significant benefits, but also the cost and surgical risks of pacemaker implantation.
Setting realistic expectations.
Yes, and explaining what life will look like after treatment. Maybe some initial activity restriction after surgery, regular pacemaker checks. Before pacing, activity restriction might be needed to reduce the risk of fainting during exercise.
Are there other specific considerations? You mentioned anesthesia being risky.
Yes, that's a big one. Anesthesia for any procedure in a dog with SSS is considered high risk. Because anesthetic drugs can suppress heart rate and function, there's a real danger of profound bradycardia or even the heart stopping altogether.
So vets need to be extra careful.
Extremely careful. They need to choose drugs very wisely, avoid certain agents, and be fully prepared with emergency pacing drugs or even temporary pacing methods during the procedure.
And referral to a specialist is usually recommended.
Highly recommended, yes. The sources strongly advise referral to a board-certified veterinary cardiologist.
Why specifically?
They have the specialized equipment and expertise for the definitive diagnosis, interpreting Holters accurately, performing atropine tests correctly. They're skilled in treatment planning, especially pacemaker implantation, which is a specialized procedure, and they're best equipped for the long-term monitoring and management these dogs need.
Well, this has been a really thorough exploration of canine sick sinus syndrome. We've gone from the misfiring electrical node deep inside the heart.
All the way to the dramatic signs like fainting, and then the really quite amazing, life-changing potential of pacemaker technology in dogs.
Yeah, it really shows, looking through these materials, how SSS can drastically affect a dog's life, but also how advanced veterinary medicine now offers a genuinely effective fix with pacing.
It's a stark contrast to the limitations of just using medications for this particular condition.
Absolutely. So here's a thought to leave you with. This deep dive highlights just how crucial understanding the heart's complex electrical system is, not just for us humans, but for our dogs too. The fact that treatments as sophisticated as pacemakers are relatively routinely available in veterinary medicine now says a lot about how far animal healthcare has come. What does this level of medical capability, this option for complex intervention, truly signify about the bond we forge with our pets and the lengths we'll go to preserve it?